Good morning all. Today we are discussing about the regulation of blood pressure. So arterial blood pressure is defined as the lateral pressure exerted by the column of blood on the walls of the arteries. This pressure is exerted when blood flows through the arteries. Generally, the term blood pressure refers to arterial blood pressure. Arterial blood pressure is expressed in 4 different terms: systolic blood pressure, diastolic blood pressure, pulse pressure, and mean arterial blood pressure. Arterial blood pressure varies even under physiological conditions. However, immediately it is brought back to normal level because of the presence of well-organized regulatory mechanisms in the body. So the regulatory mechanism which maintain the blood pressure within normal limits are nervous mechanism or short-term regulatory mechanism, renal mechanism or long-term regulatory mechanism, hormonal mechanism and local mechanism. So nervous mechanism for regulation of blood pressure, the short-term regulation via baroreceptor reflex, chemoreceptor reflex and Cushing reflex. Regulation of blood pressure varies. Cardiovascular reflex is the most important short-term mechanism as reflexes operate swiftly and effectively in response to change in blood pressure. Okay, so the nervous mechanism for regulation of blood pressure, the short-term regulation is rapid among all the mechanisms involved in regulation. When blood pressure is altered, nervous system brings the pressure back to normal within few minutes. All the nervous mechanism is quick in action and it operates only for a short period and then it adapts to the new pressure. Hence, it is called as short-term regulation. A nervous mechanism regulating the arterial blood pressure operates through vasomotor system. The components of the vasomotor system are vasomotor center, vasoconstrictor fibers and vasodilator fibers. The vasomotor area, that is vasomotor center, is bilaterally situated in the reticular formation of medulla oblongata and lower parts of the pons. Vasomotor center consists of 3 areas, that is vasoconstrictor area, vasodilator area and sensory area. Vasoconstrictor area is also called the pressure area and it forms a lateral portion of the vasomotor center. Vasoconstrictor area sends impulses to blood vessels through sympathetic vasoconstrictor fibers and this area is also concerned with the acceleration of heart rate. Vasodilator area is also called the depressor area and it forms a medial portion of vasomotor center and this area suppresses the vasoconstrictor area and causes vasodilatation and it is also concerned with inhibition of heart rate. Sensory area is in the nucleus of tractus solitarius which is situated in the posterior lateral part of medulla and pons and this area receives sensory impulses via glossopharyngeal and vagal nerves from the periphery, particularly from the baroreceptors. And also the vasoconstrictor fibers belong to the sympathetic division of autonomic nervous system and these fibers cause vasoconstriction by the release of neurotransmitter substances like noradrenaline. And the vasodilator fibers are of 3 types: parasympathetic vasodilator fibers, sympathetic vasodilator fibers and antidromic vasodilator fibers. Parasympathetic fibers cause dilatation of the blood vessels by releasing chemical mediator like acetylcholine and sympathetic cause vasodilatation in certain areas by secreting acetylcholine. Okay, and antidromic vasodilator fibers, they are cause axon reflex. Nerve fibers also called as antidromic vasodilator fibers. It's a cutaneous receptor like pain receptor. Impulses produced from these pain receptors pass through the sensory nerve fibers but some of these impulses pass through the other branches of axon in opposite direction and reach the blood vessels supplied by these branches. Okay. And moving on to the baroreceptors, the mechanism of action of vasomotor center and regulation of blood pressure is explained via the reflexes, baroreceptor, chemoreceptor reflexes. Vasomotor center regulates the arterial blood pressure by causing vasoconstriction or vasodilatation. However, the action depends upon the impulses it receives from other structures such as baroreceptors, chemoreceptors, higher centers and respiratory centers. The baroreceptors are the receptors which give response to change in blood pressure and is also called as presoreceptors and is situated in the carotid sinus and wall of the aorta. The baroreceptor reflex shows it regulates blood pressure within seconds. So baroreceptor reflex is therefore a life-saving reflex and is called as baroreflex or sinoaortic reflex. The receptors for baroreceptor reflex are baroreceptors. They detect change in pressure in the blood vessel and chambers of the heart. Receptors for baroreceptor reflex are high-pressure baroreceptors that are present in the wall of the carotid sinus and aortic arch. The functions of baroreceptors are role of baroreceptors when pressure increases and when pressure decreases. So the pressure range for response is baroreceptor regulate blood pressure in the pressure range of 50 to 140 mmHg. So when baroreceptor role in pressure increases. When arterial blood pressure rises rapidly, the baroreceptors are activated and send stimulatory impulses to nucleus of tractus solitarius through glossopharyngeal and vagus nerves. Now, the nucleus of tractus solitarius acts on both vasoconstrictor area and vasodilator area of vasomotor center. It inhibits the vasoconstrictor area and excites the vasodilator area. So the inhibition of vasoconstrictor area reduces vasomotor tone, and reduction in vasomotor tone causes vasodilatation, resulting in decreased peripheral resistance. Simultaneous excitation of vasodilator center increases vagal tone, and this decreases the rate and force of contraction of heart, leading to reduction in cardiac output. So these two factors, that is decreased peripheral resistance and reduced cardiac output, bring the arterial blood pressure back to normal. And whenever there is a decrease in blood pressure, fall in arterial blood pressure or the occlusion of common carotid arteries decreases the pressure in carotid sinus. So this causes inactivation of baroreceptors. Now there is no inhibition of vasoconstrictor center or excitation of vasodilator center. Therefore the blood pressure rises. Then chemoreceptors. Chemoreceptors are the receptors giving response to change in chemical constituents of the blood. Peripheral chemoreceptors influence the vasomotor center and is situated in the carotid body and aortic body. Chemoreceptor reflex or chemoreceptor mechanism is that whenever there is a giving a response to change in chemical constituents of blood, as we already told, the functions of chemoreceptors are peripheral chemoreceptors are sensitive to lack of oxygen and excess of carbon dioxide and hydrogen concentration in the blood. But lack of oxygen is the most potent stimulant for peripheral chemoreceptors. Whenever there is pressure decreases, the blood flow decreases, resulting in decreased oxygen content and excess of carbon dioxide and hydrogen concentration. So these factors stimulate the chemoreceptors, which send impulses to stimulate the vasoconstrictor center. Blood pressure rises and blood flow increases. And the chemoreceptors plays a major role in maintaining the respiration rather than the blood pressure. And in involvement of higher centers like cerebral cortex, area number 13 is concerned with emotional reactions. During emotional conditions, this area sends impulses to vasomotor center. Now vasomotor center is activated, the vasomotor tone is increased and blood pressure rises. And also the hypothalamus, the stimulation of posterior and lateral nuclei of hypothalamus causes vasoconstriction and increase in blood pressure. Then moving on to the seismic response, such as Cushing reflex. In conditions of gross hypotension, as in seen in acute severage hemorrhage, blood flow is compromised to the vital organs of the body. So decreased cerebral blood flow produces hypoxia and hypercapnia of vasomotor center, and direct hypoxia and hypercapnia stimulates vasomotor center to its maximum, which causes intense vasoconstriction, so that raised pressure maintains minimum blood flow to important organs, and this reflex response to CNS ischemic response or Cushing reflex. That the flowchart explains the Cushing reflex. That is whenever there is gross hypertension of increased ICP, they causes a decreased cerebral blood flow or increased blood flow to the vasomotor center, and this causes hypoxia and hypercapnia at vasomotor center, and this hypoxia and hypercapnia causes strong stimulation of vasomotor center, resulting in intense vasoconstriction. During intense vasoconstriction, it will lead to increased pressure in carotid sinus, causes activation of baroreceptor reflex. Whenever there is reflex baroreceptor, causes reflex bradycardia. It's activated in the pressure below whenever there is 40 mm Hg below pressure. This is the last physiological reflex to correct blood pressure. That is whenever there is failure of which leads to irreversible shock. That's last ditch before death. Hormonal mechanisms involve some of the hormones. Regulation of blood pressure involves some of the hormones which either increase or decrease arterial blood pressure. That is catecholamines, renin-angiotensin system, antidiuretic hormone, arterial natriuretic peptide, renin-kallikrein system, histamine and endothelins. Catecholamines are in acute hypotension, stimulation of sympathetic fibers to arterial medulla releases catecholamines, and catecholamines, norepinephrine, are vasoconstrictors. They increases heart rate and cardiac output. renin-angiotensin-aldosterone system. That is, renin-angiotensin mechanism is whenever there is decrease in blood pressure, it stimulates juxtaglomerular apparatus or signals the juxtaglomerular apparatus. So the juxtaglomerular apparatus secretes renin, and this renin converts angiotensinogen to angiotensinogen 1, and this angiotensin converting enzyme converts angiotensin 1 to angiotensin 2, and via angiotensinases the angiotensin 2 is converted to angiotensin 3 and angiotensin 4. These three hormones, angiotensin 2, angiotensin 3 and angiotensin 4, they both causes vasoconstriction, and via vasoconstriction they will increase the blood pressure. And these three hormones also stimulates adrenal cortex, and the adrenal cortex secretes aldosterone, and the aldosterone signals the kidney, and the kidney causes reabsorption of water and sodium. Whenever there is reabsorption of sodium and water, there will be increase in ECF volume. When ECF volume increases, automatically increase in blood volume causes, and the blood pressure is returned to or back to normal. That is renin-angiotensin system. ADH is a decrease in blood pressure and blood volume increases release of vasopressin and antidiuretic hormone from the posterior pituitary. ADH increases water reabsorption, and kidney restores the blood volume and blood pressure. It's also a vasoconstriction in supraphysiological concentration. A and B produces diuresis and natriuresis, is a vasodilator. Bradykinin is a kinin kallikrein system involves bradykinin. It's a high molecular weight kininogen. Is also a potent vasodilator and decreases blood pressure. Histamine also is a potent vasodilator and therefore decreases blood pressure. It is secreted from the mast cells during anaphylactic reactions. Then comes the long-term regulation of AP, renal body fluid control mechanism and aldosterone mechanism. Renal body fluid control mechanism means when the blood pressure increases, kidney excrete large amount of water and salt, particularly sodium by means of pressure diuresis and pressure natriuresis. Pressure diuresis is excretion large quantity of water and urine because of increased blood pressure. Even a slight increase in blood pressure doubles the water excretion. So pressure natriuresis is excretion of large quantity of sodium in urine because of increased blood pressure. Because of diuresis and natriuresis, there is decrease in ECF volume and blood volume, which in turn brings the arterial blood pressure back to normal. When blood pressure decreases, the reabsorption of water from renal tubules is increased, and this in turn increases ECF volume, blood volume and cardiac output, resulting in restoration of blood pressure. It is by regulation of extracellular fluid. Aldosterone mechanism we already discussed. The angiotensin 2, 3 and 4 will stimulate the adrenal cortex. Adrenal cortex is release aldosterone. Aldosterone causes kidney stimulation, and in kidney there occurs reabsorption of water and sodium will turns to increase in ECF volume. Whenever there is increase in ECF volume, it will turn increase in blood volume and back to normal blood pressure. This is all about regulation of blood pressure.